Every year, law enforcement and health systems across the U.S. host National Drug Take-Back Day. It gives the public a chance to dispose of unused or expired medication before it winds up in the wrong hands. Joining us on set is Waalkes, a specialist who works in the pharmacy at Priority Health. Thank you for joining us.
Well, thank you.
Why is this such an important day? We do this every year.
We do it actually twice a year, in April and in October. And what's so important about it is to remove the opioids from the home so that we can prevent accidental overdoses and also misuse so that the opioids don't get into the wrong hands.
So I think, sorry to interrupt. It sounds, I think a lot of people will think, well, nobody's coming into my house. Give us some examples of how they do fall into the wrong hands.
Right. Well, often what we'll say is that, children can get into these opioids. So an older person may say, well, I don't have children at home, so I'm not really worried about it. But it could be someone coming into the home, either grandchildren, it could be people who are working in the home and caregivers as well. And then they are at risk as well.
Yes, so this is a pretty simple process. You literally just bring them in and drop them off. Is there any paperwork or anything that needs to be filled out?
No, it's completely anonymous. We don't ask for anyone's name. They don't have to bring in their ID. Some people actually take a Sharpie and block out their personal information, but it's drive up, so if we have rain on Saturday, it's not a problem at all. So, and the other thing that we're doing is actually distributing Narcan, which is the opioid reversal agent. It's now over the counter, and we're actually distributing it free at our 3 sites as well.
Oh, wow. That will definitely be of interest to people. What does this look like in years past? Is this something that people really take advantage of?
They do. When we first did it, we thought for sure that the numbers would trail off, but I think last April, we had over 300 pounds collected at just our 3 sites and gave out like 99 of the Narcan. So it really is important. And the other thing is that we take not only like the Narcan, but also prescription and non-prescription drugs as well. And what we want to do is make sure that they're disposed of safely so that they don't go in the landfill. We don't want them in our water. We don't want them flushed down the toilet.
Exactly. You know, there's still a stigma associated with substance abuse. What is there to be said about this with this event?
Yeah, so often people look at it as like a moral failing instead of a medical issue. And that's a problem because there actually is medical treatment. For instance, Corewell Health has a walk-in clinic, an addiction clinic that has walk-in hours. So there's a lot more treatment available. So what we say is, look to your insurance company. Priority Health has a robust behavioral health team, and they are there to help navigate people who are looking for treatment.
That's good information. So there are a number of locations where you can drop off this weekend, and I think we have, maybe we've already taken a look at that, but we will definitely have that online as well, because no matter where you live in the viewing area, there's going to be a place that's close to you.
Absolutely. Thanks so much.
Ellen, thank you.